Hey folks, welcome back to the Curators. Those who follow us know that we are truth seekers, that we come from a place of common sense, compromise, and love. To that end, I invite you to listen to our Health Revolution USA podcast with Dr. Brian Hooker, a world renowned expert and author on one of the most important issues of our time. This is not a Republican issue or a Democratic issue. It is a human issue, one that some say threatens our survival as a species. So please, with an open mind, I invite you to join us in our pursuit of truth for a better world. Thank you. And welcome everyone to the Health Revolution USA Town Hall meeting with our special guest, Dr. Brian Hooker. On behalf of Jacqueline Capriati and Karen McDonough, our co-founders, I want to thank everyone for taking the time to be with us this evening. Especially, I want to thank our amazing team who has really helped make this event happen. We are surrounded by incredible, talented, and giving volunteers. It's quite an experience. Just a little bit about Health Revolution, guys. We are a grassroots organization. We're dedicated to empowering individuals and communities to take charge of their health. We want to help reverse the chronic disease epidemic and foster resilience by raising awareness of the dangers of toxic exposures in our food, our medicine, and environment. We will try to hold legislators, corporations, and special interests accountable when their profits and self-interest are placed above the well-being of our citizens. We have a lot of exciting plans as we approach 2025. We know that when it comes to exchanging our physical, mental, and spiritual well-being for the corporate profit machine, there is no lack of material, right? You can check us out at our website, healthrevolutionusa.org. As I mentioned, this meeting is being recorded. We have disabled the ability to unmute yourself in honor of our guest. Please do not raise your hand. If you have a question, feel free to place it in the chat. It will be taken from there, and we will assemble questions toward the end of the meeting for Dr. Hooker to address. Okay. And allow me to also say that we at Health Revolution do not offer any advice regarding health, and that includes this event. The content and opinions herein are not intended to replace consultation with a healthcare professional. So please do your own consultation for any decisions regarding your health and wellness, okay? And with that, I will turn the meeting over to our amazing co-founder, Karen, who will introduce our special guest. Thank you, Karen.
Thank you so much, Paul. I am super excited to see you all here this evening to hear this very important information. I'm going to start off by reading one of the endorsements for Dr. Hooker's book. The author's painstaking investigation and rigorous analyses are rivaled only by their bravery in exposing the depth and breadth of the lies we've been told. As a physician who never dreamed of questioning the safe efficacy claims of routine immunizations and who believed he was protecting his patients and his own children by endorsing them, I am humbled and enraged. I hope this explosive and important book finds a worldwide audience and becomes a staple in every pediatrician's and parent's library. And that endorsement comes from Dr. Pierre Corey. I'm going to now introduce our esteemed speaker and guest, Brian Hooker. Brian S. Hooker, PhD, is the Chief Scientific Officer of Science and Research at Children's Health Defense, an organization committed to the best health for children in the U.S. and worldwide. He is also a former Francis P. Owen Distinguished Professor of Biology at Simpson University in Redding, California, where he specializes in microbiology and biotechnology. Thank you, Brian.
Thank you so much, Karen, and thank you everybody for joining us tonight. I am so thrilled to talk to Health Revolution USA. Karen and I worked for several years at Children's Health Defense together, and always great to see Karen. And Paul and I met at a Children's Health Defense event last week in New York City. So, and I see so many familiar names and faces out there. And so thank you so much for joining me. I want to start right away with my presentation. I've got a lot of slides to share. I don't want to go too fast because when people do that, I get car sick. But let's go ahead and jump right in. I had the very good fortune of writing the book Vax Unvax Let the Science Speak with Robert F. Kennedy Jr. And we embarked upon this project starting in 2019. And the book came out 4 years later. It was a 4-year project. And I'll never forget when Bobby asked me, you know, if I would write a book together. And I was so honored. It was one of those pinch me, I know I'm dreaming moments. But, you know, with him being nominated for HHS secretary, we've had lots of those recently. I work for Children's Health Defense. This is a large shot of us at our CHD conference in Savannah, Georgia. We suspended the conference in 2024 for the election, but good news, it's coming back. So stay tuned for that. We have set a tentative, time frame as October, but more information is going to be coming out, and it's going to be outside of Washington, D.C., from what I hear. Please don't quote me on that. But we are science, litigation, advocacy, and education. Of course, my little corner of the world is CHD science, and I work with four of the most incredible people, Heather Ray, who is our admin and a scientific analyst for the science group, Dr. Carl Jablanowski, who's co-authored several papers with me, is an epidemiologist slash bioinformaticist. Tom Yangst, we stole from the aerospace industry. And he said that making space telescopes was boring compared to working at Children's Health Defense. And he's another person in data analytics. And then Jeet Varia, who has a PhD in chemical engineering, is another analyst that is working as a scientific fellow and has been with us for about a year. Our scientific research, we have what's called the Clinical Informatics Program, and that's really our bread and butter in terms of generating data for vaccinated versus unvaccinated children. In this program, we have about 4,000 unvaccinated children that we have followed continuously from birth. The youngest ones are about 4 to 5 years old. The oldest ones are teenagers. And we have a treasure trove of those records where by following this unvaccinated cohort, then we can follow and compare them to vaccinated individuals, vaccinated children, namely, and really answer the questions that the CDC, the FDA, the NIH has refused to answer. We also have a large portion of the Florida Medicaid database, and then the publicly available databases for the COVID analyses. Through the brilliant work of Aaron Seary at ICANN, we've been able to get access to the vSafe database, which CDC never really wanted to make the light of day. And now, as we're analyzing vSafe, we're finding out why. You know, we're seeing many, many issues regarding to cardiac damage, autoimmune damage, neurological damage, cancers, et cetera, et cetera, et cetera. And then some of our collaborations were around the whole issue of turbo cancer. We have been able to obtain biopsy samples from tumor tissues of individuals who either are currently diagnosed with turbo cancer following the COVID-19 vaccine, or they have deceased and, you know, were vaccinated and boosted multiple times prior to a cancer diagnosis. Some of them were diagnosed as stage 4 cancer patients and then were deceased within a month I mean, this is when they say turbo cancer, it is absolutely the fastest growing cancers that these oncologists have ever seen. We're also working with the state of Louisiana regarding infant death and vaccinations. With the Deputy Surgeon General there, Dr. Weitz Coleman, and they actually legislated our ability. They had to go through the legislature to get us this death certificate information and vaccine records for these individuals ages 2 and under that have deceased following vaccines. So Vax Unvax came out in 2023, August of 2023, and immediately it became a New York Times bestseller. It was 11th, its first week out in nonfiction hardcover. Wall Street Journal, it was 6th. It peaked 6th overall on Amazon. It's only sold, you'd think with those numbers that it would sell more copies. It's only sold about 30,000 units at this point in time. But it was, the media strategy now is to ignore us. And so it was summarily just ignored in the media, despite our best efforts to get press releases out and, spread the word. The mainstream media crickets. I believe that the New York Times once made reference to it in a hit piece on Bobby Kennedy after he had announced his candidacy for president as a Democrat. So really, before I get into the nuts and bolts of Vax Unvax, I want to look at the vaccination schedule. And when you look at the vaccination schedule in 1962, there were 3 needle sticks. Really, that represented 5 different vaccines because we count the DTP, which putatively protected against diphtheria, tetanus, and pertussis as 3 separate vaccines. So just a handful of vaccines, and that amounted to, just over, 5 vaccines. I believe that when you looked at boosting, it was about 12 needle sticks. Then fast forward to 1986, then added to the DPT, the MMR vaccine, and the tetanus diphtheria vaccine as a booster. And so that brought the count to 24 needle sticks through the 18th birthday, excuse me. But then you look at 2024, but wait, there's more. In 2024, we actually had to split up our chart to fit on this particular PowerPoint slide. And now we're looking at 77 doses of vaccine by the 18th birthday. So we all know, most of us here know about the 1986 National Childhood Vaccine Injury Act, which basically indemnified vaccine manufacturers from any type of suit due to vaccine injuries. And so after that point, then it was really the gold rush on getting as many vaccines in the schedule as absolutely possible. And when a vaccine is voted onto the schedule, then that is a $1 billion a year minimum in sales for that particular vaccine manufacturer. So when the Advisory Committee for Immunization Practices does approve these vaccines, then that is a boon. And the ACIP committee of the CDC is filled with individuals that have myriad conflicts of interest. Paul Offit actually voted himself rich by voting for the original RotaShield vaccine in anticipation that it would be supplanted by his own vaccine called RotaTech, and made some, it estimates that he's never really disclosed how much money he made on that deal, but the estimates lowball would be about $25 million that he made specifically for that single vote. But I want to focus on the health of the unvaccinated. And again, with the clinical informatics program, we've been able to follow a total approximately 7,600 children from birth to at least 4 years of age. Of that 7,600 children, 4,500 children received no vaccines to their first birthday. So in some of the analysis that I'm going to present today, we're looking at vaccines in the first year of life and then subsequent diagnoses that were made after the child's first birthday. So in that way, we can sort of sequence things, vaccines first, and then what happened after the vaccines were given second. We have about 4,046 children who received no vaccines at all. No vaccines whatsoever, first year of life, after the first year of life, prenatal vaccines, you name it. And the remaining children that are in the vaccinated cohort in this group, these were from practices that honor health freedom and honor bodily autonomy. So the results that you're seeing here are for children who are, according to the CDC, woefully under-vaccinated. And on average, they would receive 7 vaccines through their first birthday as compared to the 30 recommended vaccines by the CDC schedule. So what I'm presenting right now is really partially vaccinated children versus unvaccinated children. And you wouldn't think that 7 needle sticks would make a difference, but it really, really does. So when we look at vaccines through the 13th month of life, so we can capture the first birthday, we see that in this particular group of children, there are 70% more developmental delays. There's a little more autism, and autism is kind of an odd story that I'm going to get to. That we didn't have a whole lot of cases of autism in our cohort because you know what? When you see unvaccinated children and partially vaccinated children, you do not see that much autism. So our risks were relatively low, and our statistics were relatively sparse because just of the small number of children that we had with autism in that cohort. Now, asthma jumps off the chart. The rates of asthma in the vaccinated were 3 times as much as the unvaccinated. ADD, ADHD, almost 4 times as much. 2 times as many ear infections, and then about 70% more respiratory infections. And the asterisks on each one of these titles here below means that the relationship was statistically significant. So, you know, there was the chance that these results happened at random is less than 5%. So we're 95% confident that these particular results were statistically significant. If you look at males only, you see something very similar. ADHD jumps up to about 4.5 times as high in the partially vaccinated group versus the unvaccinated group. Females only, you do see a relationship in autism. That was quite odd, but again, we had so few autism cases that it's very difficult to interpret the statistics in these bar graphs around autism. But then we saw asthma, ADHD, ear infections, and respiratory infections, all still much higher in females in this particular cohort. We also looked at the effect of how many vaccines the children received during their first year of life. And so this particular bar graph, this is maybe a little confusing, but our reference group here, which would have a risk of 1.0 over here on the X or on the Y-axis, excuse me, was compared to children who received 1 to 3 vaccines in the first year of life, 4 to 6 vaccines in the first year of life, 7 to 10, and then our largest number of vaccines was 11 or more. So these are split up into what are called quartiles. So 25% of our group of children that were vaccinated received 1 to 3, 25, 4 to 6, 25, 7 to 10, and then the highest 25% in the group received 11 or more vaccines. So you see that more vaccines means more developmental delays, that it is, you know, a slight dip between 4 to 6 vaccines. That may be due to what we call the healthy vaccine-y effect, that, you know, children who get a vaccine and experience some type of issue early on in life are less likely to get vaccinated. So sometimes you'll see that the results dip down a little bit for this second group, 4 to 6 vaccines. And we saw that with developmental delays. But then when you go to 7 to 10 or 11 or more vaccines, then the risk does go up. For autism, the risk went up. Again, not statistically significant because of the low number of cases that we had in this particular group. Asthma went up, ADHD went up with the most dramatic increase in those children that got 11 or more vaccines in their first year of life. And then oddly, with ear infections and respiratory infections, just the fact that they were vaccinated in general was creating some type of innate immune suppression, something that was suppressing the immune system, because these children were much more sickly. They were having these infections at twice the rate of the unvaccinated, both ear and respiratory infections, viral infections, bacterial infections on the respiratory side, and then, of course, bacterial infections on the ear infection side. But let's look at this group of children, this unique 7,600 group or children that we had in our study. And so right now in the United States, the current autism prevalence is 1 in 33 children. In California, it's about 1 in 20 children. So, average classroom has 1.5 autism, upwards to 2 autism cases in every classroom in California. In our cohort for the clinical informatics program, the rate of autism in this unvaccinated and undervaccinated group was actually 1 in 165. So our incidence overall was much, much lower. The average number of vaccines, like I said, in the first year of life in this group was 7. Okay, so they were under-vaccinated compared to the national average, which presumably many, if not most children are receiving all of those vaccines in their first year of life. So upwards to 30 different vaccines through their first birthday. And then in previous studies, we have seen that fully vaccinated children show a 5 times greater prevalence of autism than unvaccinated children. And here's a study that I did back in 2021 with Neil Miller, who's a medical journalist who's written about 7 different books on vaccines. And this is actually, I'm sorry, this is not Hooker and Miller. This is the Anthony Mawson study from 2017. He showed that autism was about 4.2 times higher in fully vaccinated children than in unvaccinated children. In the study that I did with Neil Miller, this is an earlier study in 2020, we showed that in partially vaccinated children versus unvaccinated children, developmental delays were twice as high. Asthma was 4.5 times as high. So this is consistent with the new results that I just presented. Ear infections were about double. But then when you look at fully vaccinated children, these relationships jump off the chart. In fully vaccinated children versus unvaccinated children, this is a study that I did with Neil Miller in 2021. When we look at the red bars, fully vaccinated, severe allergies, 4.3 times higher, gastrointestinal disorders, 13.8 times higher, asthma, chronic ear infections, ADHD, all jump off the charts. And then autism is still 5 times higher. So, we see this sort of consistent 4.5, 5, 4.2 for the Mawson study, 5 times in autism in the studies that have considered fully vaccinated versus fully unvaccinated children. Here's another study that was done by James Lyons Weiler and Paul Thomas. Of course, Dr. Paul Thomas was the physician in Portland, Oregon, who submitted 13,000 children in his practice to this particular study. And they looked at actually office visits, number of office visits where these diagnoses were made. And again, you see that the vaccinated children, these were partially vaccinated because Dr. Thomas did not have fully vaccinated children in his practice by and large. But the red bars eclipse the blue bars in all instances, okay? And so what we've learned is that unvaccinated children have less developmental issues, unvaccinated children have less allergies and autoimmune conditions, unvaccinated children have less infections overall. meaning respiratory infections, ear infections, and gastrointestinal issues. And I don't know, if any of you have small children, this is a real notorious year for infections. And I believe that we're seeing the fruit of a lot of children getting the COVID-19 shot that very, very robustly suppresses the innate immune system. But I'm hearing children that are coming down with RSV, influenza, and COVID all at the same time. Okay. So these are sick children, and when you foist this gene therapy onto society, this is what we expect. We know that it suppresses the innate immune system. So we're going to have more infections, more sickness, more viral infections, more bacterial infections, and none of these really are, quote unquote, protected by the vaccination schedule. Okay. So let's look at vaccines in combination. That's one of the things that hasn't been studied very, very robustly. We know that, excuse me just a second. We know that following the CDC schedule, that infants as young as 6 months of age can get as many as 8 different shots in a single well baby visit. At 2 and 4 months of age, they can get upwards to 6 or 7 vaccines respectively. So we've run out of limbs. I mean, when my son was born, it used to be like 1 vaccine per limb, but we've run out of limbs. I'm not sure where they give, vaccines 5, 6, 7, and 8. But when you look at these vaccines in combinations, and this is a paper that I produced with my colleague at Children's Health Defense, Carl Jablanowski, over this summer of 2024. It was in the International Journal of Vaccine Theory, Practice, and Research. And what we did is we looked not at unvaccinated children. This was using a different database, the Florida Medicaid database. And our sort of reference group were children who had merely had the DTaP, the what's called the inactivated polio virus vaccine, and the HIB, the Haemophilus influenzae B vaccine. And so that was our reference group. And then in addition, we looked at combinations of Hep B, pneumococcal, and rotavirus vaccine alone. So 1 vaccine on top of that. And then in the second analysis, we looked at Hep B with pneumococcal, Hep B with rotavirus, and then rotavirus with pneumococcal. And then in our third analysis, we looked at children that got all 3 at the same time. Okay, so all 3 of these in the same doctor office visit. So we had about 7 different combinations that we looked at. But interestingly enough, what we saw, we looked at our baseline group and we looked at the average number of diseases that were statistically significantly related to that particular vaccine schedule. So in group 1, that was just receiving 1 additional vaccine, either the Hep B, the pneumococcal, or the rotavirus vaccine. So in group 1, we saw 1 developmental issue that was related to it, about 3 more respiratory infection or respiratory issues, and then about 3 more infection issues. So for a total of 7 different diseases that were statistically significant. But then when we give 2 vaccines in combination, then it goes up, doubles. Goes from about 7 different conditions to 15 different conditions that are statistically significant in this group of children. And then finally, when you give all 3 of those vaccines at the same time, that's the Hep B, the pneumococcal, and the rotavirus, then the number of diseases or conditions that are statistically significant jumps from 15 to 35. And so what these children are experiencing is an exponential increase in the possible chronic and infectious disease diagnoses that they can receive after getting these vaccines in combination. And so giving them separately or giving 1 only or 2 only versus all 3 at the same time does make a difference. Now, from our vax on vax study, I would have to say that my recommendation is no shots at all, because they're the most robust children that we are seeing. Okay. We also looked at another vaccine that, interestingly, I'll present these results. This is an article that just came out in the International Journal of Risk and Safety in Medicine. And we found a vaccine sort of hidden among the weeds. It's a Haemophilus influenza B vaccine, or a Hib vaccine. It's called Hib Titer. It was produced by Wyeth. Wyeth is now none other than Pfizer. And this vaccine came on the market in the 1990s and was very quietly pulled off the market in 2007. And so my co-researcher, Carl Jablonowski, looked at that and thought, I wonder why they just quietly pulled this vaccine off the market. So we looked at what would be significant, what would pop out when we compared the Hib titer vaccine with all of the rest of the Hib vaccines on the schedule. So we looked at the Hib titer in one group of children, and then we looked at children that were not unvaccinated, but received every other type of Hib vaccine that happened to be on the schedule. And this is what we found. And oh, by the way, yeah, like I said, Hib titer was quietly pulled off of the market in 2007. And Hib titer contains a carrier protein called CRM197. It's what's called a diphtheria toxoid protein. I'll get into that a little bit more in just a bit. And it is also used in Prevnar. And Prevnar is currently on the market. In fact, Prevnar 20 has CRM197, and it's one of the few vaccines that is recommended for infants under 1 year of age. Okay. And so this toxoid protein really was derived from diphtheria toxin, from the toxin, the actual toxic protein from the disease. But it has been putatively, and I use that in quotations with big provisos, it's been genetically modified to remove toxicity. And I'll show you that just in a minute. So if you look at diphtheria toxin versus CRM197 toxoid, and this is an ingredient in the Hib titer vaccine, also an ingredient in the Prevnar vaccine, excuse me. This is these letters, this is sort of translated, is the amino acid sequence of the protein. Of course, proteins are made up of amino acids. Each one of these letters refers to a different amino acid. And I highlight this one G here. G is for glutamic acid. And in the diphtheria toxin, then this G was knocked out of this protein and replaced with an E, which I always get into these presentations. I believe that E might be glycine. I'm not exactly sure. I'm not a protein biochemist, but they took the genetic code and these proteins, that are created by the genetic code, and they swapped out one amino acid. And then they never tested CRM197 independently in animals or in human cells, but they basically deemed that they took something that was toxic and they made this one little letter change, and then it was no longer toxic. Okay. That's suspicious to me. They never tested CRM197 independently in animal studies or in human trials. They just deemed it non-toxic. But then when we took a look at this, we saw that the diphtheria toxin prevented infected cells from making any protein. It basically killed the infected cells. The toxin causes myocarditis. Toxin causes nerve damage and neuropathy, paralysis, and kidney damage. But then we're supposed to believe that by swapping out one amino acid, it binds cells and it's perfectly safe. Okay. So we went ahead and did the analysis. We looked at billing records between 1990 and 2011. These billing records contain diagnosis codes, procedure codes, and prescription drug codes. And we looked at a cohort of about 277,000 children for this study. Hib titer did originally contain the vaccine preservative thimerosal, which contains mercury. That was phased out before 2003. We didn't want mercury to be a confounding factor in our analysis, so we simply considered those years where this vaccine was mercury-free, okay? And the diagnoses were limited to those seen within 30 days of vaccination. So this wasn't a long-term damage or a long-term vaccine adverse event. These were all within a month of the child being vaccinated, okay? And so what we saw was that in this, that there were, the relative risk here is the risk of the Hib titer group versus the other group. And the relative risk of coming down with tuberculosis was 83 times in the Hib titer group. So something was in that vaccine that was making these children much more susceptible to tuberculosis. There were 102 cases in the Hib titer group, and there was only one case in all the rest of the Hib vaccines. Okay. Then we saw the rest of these relationships were statistically significant, some of them mild, some of them more profound, like at a relative risk of 4.6, acute upper respiratory infections, acute laryngopharyngitis, which is acute sore throat, was 6 times higher in the Hib titer group. Looking down further, esophagitis was 2.7 times higher, gastrointestinal issues 3.3 times higher, and then looking at other, oddly enough, infected insect bites. These children, you know, if they got an insect bite, if they got the Hib titer vaccine, they were much more likely to have that become infected. Okay, so something definitely was going on here. And significant relationships were seen for 19 different conditions that were diagnosed within 30 days of vaccination. The conditions were respiratory, gastrointestinal, otolaryngological, dermatological, and general infections. Okay, so something was suppressing the immune system that these kids, after they got the Hib titer, were getting sicker. In 14 of these relationships, we went out to the VAERS database. VAERS database is the CDC's Vaccine Adverse Events Reporting System. And 14 of these 19 were corroborated in VAERS, that we were seeing the same thing in VAERS. But yet, this was quietly pulled off the market. Nobody was ever compensated for any of these injuries. Nobody was studied for the innate immune system being suppressed. And we have ongoing research that's being completed on the Prevnar vaccine, which is still in use. Okay, so it is still in use. And by our estimates, 35 million children received the Hib titer vaccine. So 35 million children were affected by this faulty vaccine. And now we have Prevnar that has the same ingredient, CRM197. So we are starting to analyze those data, and we're seeing some of the very, very same results. It's too preliminary to present right now, but this is the hazard that you face when you take something that's untested like CRM197, assume it's safe, and put it into a vaccine vial. Okay. I want to be really conscientious of time here. I'm going to, Karen, I'm going to present one more thing. Are we doing okay on time?
Yes, we are.
Okay, super. I want to talk to you about the MMR vaccine. The MMR vaccine, I think, is one of the most damaging vaccines on the schedule, and was probably the most damaging vaccine on the schedule prior to the introduction of the HPV vaccine for adolescents, and then, of course, the COVID-19 vaccine. But I was able to interact with 2 whistleblowers from Merck. These Merck whistleblowers, their names are Stephen Kraling and Joanne Lokowski, and they actually worked at Merck around between 1996 and about 2004, 2005. They filed a false claim suit against Merck in 2010. And it turned out that their accusation was Merck was defrauding the CDC regarding how much virus was in the MMR vaccine that they were selling to the CDC. Of course, the MMR is a live virus vaccine, so it actually contains active virus particles of measles, mumps, and rubella. Okay. Unfortunately, 14 years later, I mean, these things drag out in court for years and years and years. The case was dismissed and then on appeal dismissed in late 2024. Okay. And the judge argued that evidently, since CDC knew that Merck was defrauding them, that the fraud was legal. Okay. So, in other words, if you discover somebody's defrauding you and you continue to buy the product, which is what CDC actually did, they discovered the fraud and they said, oh, you get a pass, we completely buy it, then the fraud is absolutely legal. I think that this is, a boon for criminals everywhere that want to do this. All you have to do is the day before it goes to court, confess the fraud to the individual that you defrauded. If they let you go and say that it's okay that you damaged the public, that you created, I don't know, 200,000 cases of autism, then it's absolutely fine. Okay. So I want to give you a little jingo here, a little vernacular. There's what's called TCID 50. TCID 50 is just another way of conveying the number of viruses that are actually in viral or in these vaccine vials. It stands for tissue culture infectious dose. That's one infective dose that will cause 50% of human cells in culture to become infected with either measles, mumps, or rubella. So in other words, it's another name for virus particles. Okay, and this is the assay that Merck used to quantify the number of active virus particles in their MMR vaccine. And it's an assay of the infectivity of the virus against the host. And in some ways, it dictates the strength of the vaccine that is being put in the arms of children. Okay, usually this is reported in log base 10. Everybody think back to Algebra 1 and Algebra 2 when you did logarithms in log base 10. So we had 10 to the first power was 10, 10 to the second power was 100, 10 to the third power was 1,000. And so some of these numbers, you're going to see a log value rather than the actual value. I'm going to try to interpret it as we go along. But the whole question came down to how much virus was in the vaccine vials versus how much virus has ever been safety tested on children in clinical trials. Okay. And so it turned out that Merck required Merck was required by FDA to address the fact that the mumps vaccine was losing efficacy, and that's well known. The mumps portion of the MMR does not prevent a mumps infection. It usually wears off in adolescence, and there are mumps outbreaks in fully MMR vaccinated populations of adolescents and young adults. In order to compensate this, Merck started to overfill the vials with not only higher levels of mumps virus, but they also overfilled measles and rubella at the same time. It was more convenient, and they want to make sure that they weren't having the same problems with measles and rubella. Okay, so their starting value of virus, they filled to 150,000 virus particles. Now, a standard mumps vaccine is 20,000 virus particles. So in 1999, they increased their level from 20,000 to 150,000. But the dirty little secret was they had never tested this above 20,000 for safety. So they were adding almost 10 times as much mumps virus than what had ever been safety tested. Okay. Then in 2002, it turned out that that was not enough because the mumps vaccine was losing potency very quickly, and it's supposed to have a 2-year shelf life. Then Merck's executive director of worldwide regulatory affairs said, that's not enough, let's boost it again. So they boosted it up to 250,000 virus particles, again, about 10 to 13 times higher than anything that had ever been safety tested in children. Okay. This says safety, this is incorrect. Safety testing is really around 20,000 virus particles. I apologize for that. So, and then considering the testimony of Steve Kraling and Joanne Lokowski, some of the virals, they're produced in the vaccines are produced in these large vats that have issues with mixing. And if you get a poorly mixed batch, then you get more virus or less virus. Then some of the vials could be as high as 500,000 virus particles. And again, this applied to measles and rubella, not just mumps, over 3 times higher than what was originally recommended. And again, 25 times higher than anything that's ever been safety tested. Okay. And only 20,000 of these tissue culture infectious doses or virus particles is required for mumps immunity. So they're giving you 25 times higher. So in other words, Merck started overfilling these to the highest level in 2002. And as far as we know, they never stopped. They never stopped. We don't know how much virus to this day is in the MMR, but we know it is much, much higher than anything that's ever been safety tested. Okay. So they started out, let's see, at 4.3 logs. That's about 20,000. They moved up to 5.2 logs. That wasn't enough. Then they moved to 5.4 logs. And then because of process constraints, then some vials are at 5.7 logs or 500,000, virus particles. Let me skip these things. These are just expert witness. I can make the slide deck available for everybody. This comes from Steve Kraling's deposition, and again says some of the executives at Merck were saying that they were as high as 500,000 virus particles. Okay. So the no man's land here is in the red. That's never been safety tested. And you notice that if you look at the NMR package insert, it does not give you the high level of the virus. They just simply omit that part. They say that after reconstitution, that each vial approximately 0.5 ml dose, that's a single dose of MMR, has 3 logs of measles virus, 4.1 logs of mumps virus, and 3 logs of rubella virus, not less than, but they never say not more than. Okay, so they can put really, according to this packet insert, whatever they want, regardless of what was safety tested. Okay, so never says how much virus is actually in the vaccine. So we looked at this and we looked at VAERS reports, and oddly, when they started this overfilling practice in 1999, the total number of VAERS reports then increased precipitously through the early 2000s, did start to come down after this point in time. And this corresponded to the CDC stopping individuals from filing VAERS reports for autism. Okay? It's very, very difficult to file a vaccine autism report now. But I believe that this is really the peak that we saw because of overfilling these vaccines with virus. Okay, so the overfill started here. Then when you look at anaphylactic reactions versus year, anaphylaxis versus in the MMR was virtually unheard of. When you look at, this is Merck data, and then actually pops on the scene in 2000, 2001, through 2007. And so we see this increase in anaphylaxis because they overfilled these virals and became a thing. Okay, that's where overfill started. Let me jump to the end because I love shamelessly promoting my son. And that concludes my presentation.
Wonderful, thank you. I think we can go to questions now, so I'm going to go to the document. Let's see. I'm going to start here. This one's from Lori Harvey. It's been several years since the COVID-19 vaccine came on the market, but it's not being seen on the excipient list. Why do you think this is, and do you think we will ever see it on there?
The COVID-19 on the excipient list. Okay, I'm trying to understand that a little bit better. And Lori, shout out to you, good friend. Always good to have you participate in these. Maybe can we go back to that, and can you give me a little more detail, Lori, because I'm not quite understanding that question.
I'm going to go.
Lori can unmute.
Okay.
Hey, Brian. The excipient list is the vaccine ingredients list that you see on the CDC website.
Oh, right. Yeah. I'm sorry. You know, we needed to sue for that. Okay. Because the only way that I get that information is going back to the clinical trials data for the Pfizer. And the clinical trials data for the Moderna. It is embedded in that information that Aaron Siri had to sue for. But no, that's still not there. And you know, that's one of the things that I will point out to my colleagues at MAHA and MAHA Action, because that needs to be correct. Has anybody looked at the packet insert for COVID-19? What's there, Lori?
It's a blank page.
It is a blank page. It is a blank page. So, you know, if you wondered whether you were participating in a grand medical experiment or that they were trying to hide from you, now you know.
Yeah.
Does that help out?
Yes, it does.
Absolutely. Thanks, Lori. Thank you so much.
Thank you.
Okay, next question. As an expecting mother, are there any vaccines that could be recommended, deemed somewhat safe? Should I delay vaccines until my child is older or not give them at all?
Well, you know, I want to put this in context because I am the parent of a child with a vaccine injury. A lot of you know my story. My son is 26 years old. He has profound autism. He is a non-speaker. He has no language. He can't communicate by spelling. He desperately wants to speak, and he goes through a lot of pain. To this day, he goes through severe GI pain. One vaccine can do that. One vaccine can do that. And you know, in my instance, my son received 3 vaccines while he had an active ear infection. But I hear story after story, and it's not just the MMR. It's other vaccines that are causing severe, lifelong, debilitating damage. And so, you know, as a parent, you know, I'm not a practitioner. I'll put on my parent hat. Okay, this is my parent hat. I'm not a practitioner. As a parent, I could not see vaccinating another child.
Thank you, Brian.
Okay, I'll be a scientist again.
Next question. I'd like to know if there are any studies that looked at the incidence of SIDS, sudden infant death syndrome, following vaccination.
Yes, if you look at PubMed, just Google PubMed, go to the National Library of Medicine, and then type in the search Miller NZ. That's Neil Zell Miller. He has done one of the best studies on SIDS and the proximity of vaccination. And what he found, there are some studies that show that the rate of SIDS on the day of vaccine or the day after vaccine is 80% of all SIDS cases. So 80% of them occur within 24 hours of vaccination. Neil's study shows something a little bit different. It shows that 70% occurred within a week of vaccination and 50% occurred within 3 days of vaccination. And so it's interesting that they cluster around 2 months, 4 months, and 6 months of age. What else happens then? Well, baby checkups. And so, yeah, look for that study by Neil Miller. And I believe my email's in the chat. If you can't find it, email me and I'll send you a copy.
And I'm going to give you one more question, Brian. I think this will probably be our last one. And this is from Jacqueline Capriati, one of our co-founders at Health Revolution USA. Dr. Hooker, as a parent of children with cystic fibrosis and a transplant, I'm in a difficult position. I recognize the critical role vaccines play in protecting vulnerable populations like my children, but I'm deeply concerned about the lack of progress in vaccine development, particularly in reducing side effects, implementing robust systems to track adverse reactions, and improving effectiveness for those with unique medical needs. How can we advocate for meaningful advancements in vaccine safety and efficacy while navigating a landscape where asking for better options is often dismissed or seen as a threat to public health?
I love that question, and shout out to you for we met last week at the CHD Gala event in New York City. It's such a wonderful opportunity to be able to meet you. But that is such a good question, because these individuals that really are sitting doubts regarding vaccination, because a lot of times they're severely immunocompromised. I know this because my son is immunocompromised because he's on immunocompromising medicine because he has a variant of Crohn's disease. And so, we when we sat with our nurse practitioner, allopathic, that gives us that we check in when every year he started talking about the pneumococcal vaccine, and I hold up my hand, Google my name, and then come back. Then we'll have that conversation. But really, what's being found out is that multiple vaccines and foisting these vaccines are actually causing these kids to be more susceptible to infections. And that's one of the take-home messages of my latest vaccinated versus unvaccinated data. We're seeing more ear infections, we're seeing respiratory infections, and gastrointestinal infections. And so, I believe that it is incumbent that we get in the face of our elected representatives right now so they can support MAHA, they can support Make America Healthy Again, that they can understand what vaccines are and how we've been lied to over, umpteen years, especially since the 1986 National Childhood Vaccine Injury Act. For goodness sake, confirm Bobby Kennedy already, and then also advocate, let them know, that you have a wonderful special child, that this is the child's malady, and that these types of diseases are becoming not the exception, but the norm when you look at the chronic disease epidemic. I know that cystic fibrosis is a CFTR gene mutation, and that it is a genetic disorder, but there are other disorders that are, sort of gene environmental interactions that are chronic diseases, and they need representation too, because they fall really in the same type of situation.
Great. Thank you, Brian. And I think Paul would like to ask a question now.
Thank you so much. Dr. Hooker, that was an amazing presentation, and you really are letting the science speak. Thank you. And there's going to be a lot of great takeaways from this. I'd like to just ask you something that's tangentially related to the topics this evening,
Sure.
Having to do with this concept of the fox guarding the hen house. And something we've learned from Bobby Kennedy is some of the perverse incentives that exist in the agencies. Pediatricians being incentivized to administer vaccines, often when they don't even know what's in them, and it's very lucrative for them. the revolving door between the companies and the agencies that exists, where the approval process for a lot of these drugs and vaccines are an avenue for promotions. We can go down the list, right? Um, Bobby Kennedy can't get into HHS soon enough for those
Right.
reasons, among others. Is your experience, what is it there? Do you have any recommendations or the things you'd like to see immediately done to improve or rectify this situation? Thank you.
I do not want to see any researcher in the federal government financially incentivized to patent technology that is going to be used for commercial interests, for profit. First of all, healthcare is expensive. And we know that the reason why remdesivir was one of the reasons why remdesivir was recommended over against ivermectin was because it was on patent, and that Gilead Sciences and then the National Institutes of Health made hundreds of millions of dollars, and a lot of that money went to the individual researchers' pockets. They can make up to $150,000 a year on their royalty stream as a federal employee. When I was a federal employee, I worked for a federal contractor. I was incentivized by that. I have 5 patents. I cannot say that I wasn't incentivized by that. I wish, I wish that I was pure as the driven snow, but that needs to go away. That type of incentivization, and then any incentivization between health insurers and practitioners for vaccination needs to go away immediately. That is such a gross conflict of interest. I know of practitioners that got over $500,000 for pediatric vaccines. I know of practitioners that got over $1 million a year for giving out the COVID shot. It is absolute nonsense, and there are better ways to run a business than basically to go figuratively to go sleep with big pharma at the expense of children's health.
Well said. Thank you. Yes.
I think, do we have time for any more questions, Paul, or it's a.
I think we've gone over an hour now. I think we can wrap it up here. Certainly if people have questions, they can contact us. I'm sure Dr. Hooker wouldn't mind spending a few hours, maybe a few minutes responding to a couple more questions offline. But thank you.
I have help. I have peeps that help me answer my emails, so please don't worry about that. Not at all.
Okay,
And if
fantastic.
I can encourage everybody to consider, I don't know if you can see it on the screen here, purchasing Dr. Hooker's book. If you know anybody who is expecting a child or thinking about having a family, I think this would be much appreciated to have this book and have easy access to this very important information.
There you go. Shameless promotion moment. There we go. Yeah.
Thank you.
Absolutely. Thank you so much, Dr. Hooker. It's been an honor having you here with us.
Thank you very much. The honor's all mine. Thanks for being such an attentive audience too.
Thank you.